understand it, reviewing medication can be critical in improving physical health. So first of all, why is it important to review medication?
Well, of course, we need to accept right from the start that medications for schizophrenia aren't the cause of all these problems, but in certain individuals can make the problem worse. However, the other problem we've got to discuss is, of course, the fact that sometimes people are on 3 or 4 medicines, and each one of them is a disaster with respect to weight gain. Now, it's absolutely important that I think every consumer says to their doctor, do I really need this? Why am I on this? Is there an alternative that can help me lose weight?
And why does medications cause a weight gain?
Well, there are many reasons, but probably the most simple in the short term is they're antihistamines. I don't know if anyone in the audience has ever taken an old-fashioned antihistamine. When I lived in Perth, I used to get hay fever. I used to be so hungry with the old antihistamines, I'd eat the box they came in. And some of the most powerful medicines we have in schizophrenia are in fact actually very powerful antihistamines.
So you need to be on the right medication and the right dose, but as few as possible.
Indeed, but it's also not the anti-psychosis drugs that cause it. It's a lot of the other drugs that people are given. The mood stabilizers, when you don't need a mood stabilizer, probably puts on more weight than some of the antipsychotics.
Our question from the audience was, we know that in the first few weeks of starting medication, that some medications, the side effects include a lot of rapid weight gain. We wanted to know if exercise during that time and if healthy eating will make a lot of difference, given that the weight gain can be, we know, quite extensive.
The answer is, in the real world, no, because by the time anyone realizes it's a problem, it's too late. However, a couple of nice big studies in the US where they actually started people on healthy eating, healthy exercise before switching them to some of the naughty medicines. And lo and behold, their overall weight gain over the first year was significantly less. But you've got to start the program before you do the new drug. But it does work.
Talk to your doctor about what you can do before you start the medication to try and minimise weight gain.
Yes, but unfortunately, many of the medicines are actually switched when people have been a bit crook, and they're not really in the right space sometimes to sort of talk to people about the big picture. All they just want to do is feel better and get out of hospital. However, I think what needs to happen is you need to talk to your doctor when you're well. So next time, if I get crook, I want my whole body to be looked after, please. So let's think about exercise programs. Now, I might not be able to tell you this when I'm sick next time.
The reality is, to change physical health, we actually have to change the environments in which people are already in. And one of the environments that people are subject to is the medications. There is a campaign on at the moment because there is some new drugs in the pipeline that have been held up by the federal government and they're not being allowed to go onto the PBS. These new drugs actually have a much lower side effects in relation to weight gain, and it's time for us to actually really get on the bandwagon of that campaign to bring those new drugs forward, because there are so many issues that someone with a mental illness is up against. They shouldn't have to fight the drugs they're on as well as everything else.
Any health professional who's claiming to practice comprehensive modern medicine or whatever else it is they're doing ought to be looking at physical health and mental health issues together. It's just substandard clinical practice we're hearing about here. For somebody to be obviously having a very, very serious weight problem and you're not even commenting on it shouldn't be allowed. So yes, there are some serious things for health professionals, particularly medical health professionals, to face up to here.
So I've written all the sorts of things that I expected people would raise today about what improves your physical health: a good relationship with your general practitioner, a group to do your exercise with, do not smoke, monitoring of the risk factors, for example, overweight, eating too much, not moving enough, reviewing the medication, support from friends, peer support, move more, eat less, family and carer support, self-respect and advocacy for yourself. We've talked about social connection, we'll talk about work in a moment, friends, and raising physical health as an issue with your doctor.
We are literally all there we're being paid to provide you with services, and you've got to ask for them. You've got to say, I deserve as good physical health as anybody else.